Yes. In Jesus' name, I pray and believe.
Amen.
Amen. Thank you very much, Steve, for starting us off with a word of prayer. And today being International Men's Day, the theme is celebrating men and boys, basically focusing on recognizing the positive roles of men and boys that they play at home, at work, and in the wider community. And so with us today, we are privileged to have Dr. Frederick Wangai, whom I will invite to introduce himself. And he'll be taking us through quite a lot. So I urge you to have a notebook somewhere, invite a colleague so that they're not left behind. Over to you, Daktari. And please, as you join, please mute your microphones and your videos so that we don't distract the doctor. We will have a Q&A session at the end where you can either raise up your hand or feel free to chat us or drop a chat in the chat box. Thank you very much. And with that, karibu sana daktari.
Thank you very much, Yvonne, for that introduction. Allow me to just present my slides. And kindly confirm to me once you can see them. Are you able to see my slides?
Yes, we are good to go, daktari. You can see the slides.
Good. Fantastic. Yes, so thank you very much, gentlemen and friends of gentlemen who are the ladies in the house. Thank you for coming to support the gentlemen on this exciting International Men's Day. You know, we don't celebrate men as much, and we think we need some affirmative action for men. You know, we have everyone talks about the girl child and how we need to empower the girl child. But we actually realize that men are suffering. Men actually have a lot of issues that we keep within ourselves, and we feel that it is not masculine enough if I show any form of weakness or any form of issues that I am dealing with. However, today we really want to, as you said, celebrate men and boys. And I chose this theme, men's health pit stop. And most of the men here understand what a pit stop is. I know some ladies may not know. Don't worry. When we have International Women's Day, we will have something that only the women can understand. But really, at the end of the day, if we're thinking about performance, for example, of this Red Bull car and or Formula One, you need to have a good pit stop, a good place where you can actually quickly do diagnostics, quickly check, quickly replace what needs to be replaced, service quickly, so that one can be able to win the race. And today, as men, we are all winners and we want to win the race. So today, that's what we want to talk about. How do we go through a pit stop for our men's health? My name is Dr. Wangai. I am a consultant physician by profession. I practice a lot of things both in the university, academia, but also in private practice, where I really focus a lot on holistic wellness. So we have a center called Salubrity Center that basically focuses on individual and also corporate wellness solutions that are holistic, body, mind, and spirit. So we do a number of things. I'll talk a lot about men's health and wellness and what we do in terms of this for men. But to start us off, I know many of us are heading to end year season, crunching, figures in the office, and sometimes we end up feeling a little bit broke. But today I want to encourage each and every one of us. We are all trillionaires. Trillionaire, not just in Zimbabwean dollars, as you can see here, but in terms of US dollars. So the next time you are broke, look at your body. In fact, let's do this right now. Look at the person sitting next to you and tell them, I am a trillionaire. If I to take my heart, my kidney, my pancreas, all the body organs and chop them up and actually put them on the black market, we'll actually find that we are worth a lot of value. And so that's why we need to take care of our bodies. We need to take care of our health. Don't play with your health because it is your wealth. Your lifestyle can also make you crash. So we need to be very, very careful on how we live our lives because we don't want to end up crashing. If we think about men's health and the world over and in terms of media and what people generally think men's health is all about, you'll see such images, someone with big muscles, and I'm sure we all know who Chris Hemsworth is, or Vin Diesel. This is what people think health is. Health is equals to muscle. But my dear friends, we are actually wrong. We're actually wrong. Men's health is not just being muscular, and showing your six pack and your abs. This is what I picture true health to be. You can see this gentleman here, he's a bit aged, but you can see he looks flexible. He has his gadgets measuring his exercise. You can see he's wearing his running shoes. He actually he's physically fit. Another example
would be one way to describe Dr. Ellsworth Warren. The 100-year-old retired heart surgeon occasionally does his own yard work. He walks regularly, still drives.
You drove here today.
Driving is nothing. I worked till I'm 95, assisting, mind you.
Yeah.
I could have done heart surgery, but it wouldn't have been fair to the patient because sometimes you need reserve strength. If you gave me something to memorize, I would memorize it just as quickly now as I would when I was 20.
How is your health?
Oh, superb. I haven't got an ache or a pain.
The great-grandfather believes his plant-based diet plays a big part in all this.
If your blood cholesterol is under 150, your chances of having a heart attack are pretty small. Now, my blood cholesterol is 117. There's no chance of me having a heart attack.
So you're heart attack proof.
Let us say I'm dealing in an area which I understand.
Perhaps another key to Warren's longevity, not letting problems weigh him down.
How big a role does stress play in your life? And
You asked the wrong person. I have a philosophy, you do the best you can, and the things you can't do anything about, don't give any thought to them.
what motivates you nowadays?
I feel that I have to make a contribution. When I was doing surgery, I made it by operating. Now I try to make it by speaking about preventive medicine.
And showing people just what 100 years old can look like. Dr. Sanjay Gupta, CNN, reporting.
Wow, that's interesting. I don't know, is our chat... Yes, hello.
Oh, Mama.
Sorry, please mute your mic. Yeah. Just wondering, what do we think are what from this video that we've just watched, what are some of the secrets towards living healthy and living long? Are we able to type on the chat? Is the chat enabled? I'd like to see some of our responses, if possible. Or maybe that is not available. Yvonne, do we have a chat function on this module?
Yes, we do. Yes, we do. And members can engage there.
Fantastic. Yes, so I'd like to see some responses. If we have some on the chat, what do you think are some of the secrets and really some of the lessons that we've learned in terms of being able to live long? Yes, I can see Anthony says diet. Irene says healthy eating, fantastic. Amy says having a more plant-based diet, not vegetarian, but more planty. Interestingly enough, my grandfather, whom I'm named after, was born in 1931. So he should be celebrating his 94th birthday, December 25th this year. And he does not have a walking stick. He stands up straight. He drives every week between Nairobi to Murang'a and back, and carries out his daily living. He graduated with his PhD at the age of 85. So, about 5 years ago, went for his graduation party. And really, at the end of the day, what are some of the things that can actually make someone live healthy and live long? That is what we really want to discuss today in terms of men's health. Are you able to see my slides? Yes. You can see my slides.
Yes. Yes, we can.
Oh, okay, fantastic. So if we were to take the driver's seat in terms of, taking charge of our health and being able to move from a disease state where we could call it illness to wellness, and you can see all we need to do is replace I with we, and illness can change to wellness. And I thought of, again, an analogy of a car. If I was to move, and drive all the way from Nairobi to, let's say, here is Cape Town and here is Nairobi, what are some of the things that I would need to think through so that I can ensure that I will arrive at my destination? It's a long distance between Nairobi to Cape Town. If I was to drive that distance, what are some of the things that I would need to think through so that I ensure I arrive safely? Again, please put your answer on the chat box. I'd like to see what are some of the things. I know we all drive here, and most of us, drive. What are some of the things that, we need to think through and need to take into account before we start our journey? All right. One, I really need to think through, have I taken my car to the pit stop? Have I taken my car for a service? Because I don't want to drive a car such a long distance. And the last time it was serviced was 3 years ago. Number two, I need to think, what happens if I break down along the way? Do I have some way of being able to mitigate or being able to get some form of rescue during a breakdown moment? Have I undertaken my maintenance well, in terms of my engine is good, and do I have enough fuel to take me along the journey? Have I been able to undergo good diagnostics for my car? What is my performance strategy so that I can have a high performing car and a and a good safe journey all the way? The cooling system of my car is also really, really, really important. And I need to think about the road ahead. What are the danger spots that lie on the way from Nairobi to Cape Town? Do I have a map so that I'm not just guessing where I'm going, but I actually have a clear vision of the road ahead? And that's what we really want to talk about today. 7 key points. We'll undertake them briefly in terms of our own health. Do we have a pit stop? What do we do when our bodies break down? How can we maintain our bodies? How can we do diagnostics, etc., etc.? So really, we need to ask ourselves, are we tuned up? Are we tuned up for the race of life, or are we just living day to day, just by luck? We need to be intentional and really tune up. But to understand this, we need to go back to the very beginning as men. Do you know that the human egg, as you can see right here, is actually 10 million times larger than the sperm? So next time you think that as a man you're bigger than, your sister or your wife, really think you actually started off as very small, right from microscopic to a baby. That's the miracle of life. But the interesting thing is, all humans, whether male or female, especially to my dear men in this chat, all of us began as female. So nature has designed it, God has designed it that actually women and the hormonal structure of being female, the female hormones are actually the most protective in order to preserve life. So they actually make the baby healthier and fitter for survival. And so in order to ensure that the baby actually survives long enough to be formed fully, all of us have to begin as females in our mother's wombs. But something happens at week 5 or week 6 inside the mother's womb. And those who are designed to be boys, that is, those who have the Y chromosome, a hormonal burst comes over. And now, at that point in time, a male starts beginning.
Actually, like to hold your Daktari, there's no sound. I don't know if it's just on my end.
Can you hear me now? Hello.
Now I can. Yes, now I can hear you.
I think I was muted when someone else was speaking. All right. And so what I was saying is all of us from birth start off as females, but at week 6, at that point in time, that's when if a man has a Y chromosome, testosterone now makes them go into a male. But those who do not have the Y chromosome, those are females, remain as females and continue being females. Now, because we as men lose a lot of the female hormones and start getting the male hormone, it means that we lose our protection from many of the diseases. And men are more likely to get sick. Men are more likely to have breakdown moments. I love this. There are 3 stages of life in Kenya: birth, stage 2 is weh, and stage 3 is death. Now, many of us, I think, should be in the stage of weh, especially now as we are about to hear the state of the nation at death. But really, at the end of the day, we need to be careful because we don't know what dangers lie, especially in our health. There's a lot that happens, especially for men. Men are actually most likely to get sick and die from different diseases such as heart disease, obesity, diabetes, cancer, workplace injuries. Men have actually been shown to die earlier and on average 5.3 years earlier from preventable diseases. Look at Kenyan statistics. 50% of all hospital admissions and 20% of deaths are due to high blood pressure, stroke, diabetes, gout, cancer, and different complications such as kidney, heart, liver failure. And you can guess between men and women who are more likely to have those diseases and be admitted to hospital? Men. So that is very, very, very interesting. And it means that men need to pay more attention. Take, for example, mental health. We know that 1 in 5 have dandruff. Okay, so if you're seated in your office and you can see your colleagues in the open plan, just count 1, 2, 3, 4, 5. One of you has dandruff. But interestingly enough, 1 in 4 have some form of mental illness. So again, look at the people in your room right now, and 1 in 4, count 1, 2, 3, 4. If you can't see anyone with mental health illness amongst those 4, maybe you need to check yourself. But really, on a light note, the commonest mental health conditions we can see in Kenya: depression, anxiety, substance abuse, schizophrenia, bipolar, stress disorder. And you can guess who are more likely to have these mental health conditions? The answer is actually men. Look at Kenyan statistics. Suicide deaths in Kenya over the last few years have been on the increase. And the most vulnerable populations have been those between age 55 to 64 and also young adults 25 and 44. But as you can see, green represents men and blue represents female. More men are committing death by suicide every year, and this number is going up and up and up. And so, my men, it is time to be real. Let's ask yourself these few questions, just to have that self-reflective moment. Over the last 2 weeks, how often have you been bothered by the following problems? Over the last 2 weeks, how often have you been bothered by the following problems? Have you had, sorry, I think that's someone speaking. Please mute the mic. Yeah. Sorry, please mute. I think it's FCM, Key Accounts Manager. Yeah, thank you. How over the last 2 weeks, how often have you been bothered by having little interest or pleasure in doing things, feeling down, depressed, or hopeless? Have you had trouble falling asleep, staying asleep, or sleeping too much? Have you been feeling a bit tired, having a little energy? Have you had poor appetite? Or on the other hand, have you been overeating? Have you been feeling a bit bad about yourself, feeling like you're a failure? You've let yourself or your family down? Have you been had trouble concentrating on such things such as, reading the newspaper? Have you been moving or speaking slowly that other people have noticed? They say, hey, enyewe Charles bana, siku hizi unakuwa slow kidogo, Or have you had thoughts that you'd be better off dead or hurting in some way? Now, answer all those questions. And really, this is actually what we call a PHQ-9 score. So if you've answered yes to any of the questions that I've just asked above, please come and seek help. Come and see us. Come and see, your doctor because you could be suffering from depression. So depression is something that is very, very common amongst men, and it has different symptoms, as I've just shown earlier. And really, at the end of the day, depression affects our mind. We are unable to focus. We are unable to be productive. We get tired. We are unable to actually function. As you can see, your brain just cannot do what you want it to do. Men are more prone to mental health conditions. Switching gears, November, we tend to talk a lot about the prostate. What are some of the things that we need to know about our prostate and our sexual function? Now, for those of us who did biology, this is just a nice picture that shows, what really happens inside the man. So we have the testicle, which produces the sperms. These go up through a certain pipe all the way around the bladder and into the prostate gland. So the sperms swim up through the prostate gland. The prostate gland is a pit stop where uh, um, chemicals and nutrients and food for the sperms is produced. They get eaten, they eat up in there, and they get nourished so they can continue their journey out of the male body. So at the end of the day, the prostate is very critical for sexual function. It is very critical because it also sits underneath the bladder. It sits underneath the bladder of the male. Now, females, I know you may not understand much what it means to have a prostate. It's okay. But for men, well, let me talk to the men a little bit today. The prostate sits underneath the bladder. So if you have any problem in the prostate can actually squeeze the pipe that releases urine from the bladder. So this pipe here can be squeezed. And so many prostate diseases or prostate problems actually present as urinary symptoms where you cannot urinate very well. Now, if your prostate has a problem, what is the best way to check for your prostate problem? Best way to check for prostate issues is actually through a finger. We call this DRE. So we insert a finger right through your back passage where stool comes out, and we're able to feel the prostate very, very, very nicely. Now, this is, and I don't know how many men here, maybe you can, I don't know, they feel free to put on the chat. Have you ever had your prostate checked this way? On a light note, but these days we have another method, which is a blood test. So I encourage all men, please, once a year, especially if you're above the age of 50, please go and get your prostate checked. It's a small blood test, takes just a few minutes, and it gives a lot of information. For those under 50, getting a prostate test or a prostate blood test can also help to show if you have infection or inflammation of your prostate, prostatitis, or what we call prostatitis. Really important, especially because many men, sometimes you feel you have a dull pain, just below your belly button. Dull, it's like a discomfort. Sometimes it comes with urinating, sometimes it comes during sexual activity, other times it just comes on its own. That could be an early sign of prostate infection or prostate disease, which you need to get checked for. On the other hand, once the prostate becomes enlarged and has issues and has a disease, it actually stops the flow of urine from flowing out because it blocks. So let's ask all the gentlemen, how is your plumbing? How is your plumbing? Do you have problems urinating? Do you have difficulties starting urination? Do you have a poor or weak urine stream? Or sometimes you're over urinating, especially at night. Do you have pain during sexual activity? These are some of the symptoms of prostate disease. And we know that if now we go to cancer, shifting gears, the number one cancer again amongst men is prostate cancer. So prostate is really, really important. Many people think it only comes above the age of 50, but I have seen cases where you have people under the age of 50 who also get prostate cancer. Most of prostate cancer is genetic. So you may have a father, an uncle, a brother, or a distant cousin who may have prostate cancer. That puts you at a higher chance of getting prostate cancer. Other causes or other risk factors for prostate cancer, apart from being black, is age. I've talked about age, having first degree relative, having a diet, a diet that is high in fat, especially from red meat and also dairy. Now, these are the World Journal of Oncology statistics, so it's scientifically proven. Red meat, dairy, high-fat diet does lead to prostate cancer. Being obese, on the other hand, yes, you have your kitambi, which is your public opinion, can also contribute to having prostate cancer. So let us think about how we live our lives, because this is how cancer starts. You can see this is how the cancer is, and it pushes into the urethra, which is the pipe that takes out urine, and it grows and grows, and sometimes it can even grow from a tiny speck to take over the whole prostate, and even getting out of the prostate, and it even affects the rectum where stool comes out. It can even go into the bone. I've seen people with prostate cancer in their spine, in their backbone, and so the prostate cells go into the backbone and actually cause full paralysis. I've seen prostate cancer go to the brain. So it is a serious, serious condition. And we call that stage 4 cancer. Stage 4 cancer is where the cancer cells go outside where they originally started from. So they can go, you can see, to the epididymis, it can go into the blood, it can go into the bone, can go into the lymph nodes, can go literally anywhere, into the rectum where stool comes out. And you can have cancer looking as crazy as this, as you can see. Not a very good sight. So, my dear friends, if you have any problems or any difficulty or any unusual issues when you're urinating, those could be a very early signs of prostate cancer. So please get checked, because whenever you catch cancer early, you can cure it. You can cure it. So if there's one thing I want to ask men to remember, your urine needs to flow properly. It needs to flow nicely. If you have any problems, any unusual abnormalities in your flow, then please come and get checked. We know prostate cancer, not only does it affect the urine, but it affects the bones. So people with bone pain, back pain, people with fatigue, loss of appetite, a swelling in your legs, nausea, vomiting, even anxiety, depression, or feeling any cognitive impairment, those could be signs of prostate cancer. Cancer can affect any part of the body, and we really want to make sure that we get ourselves checked every at least once a year. Get a full check done, because you'll be able to catch cancer early. This just shows you some of our patients who, for example, this is lung cancer, comes with smoking, again affects more men than women. This is picture of cancer in the bowel, and we're grateful to our patients who allowed us to use their specimens for educational purposes. And you can see all this is actually cancer of the intestine, what we call gut malignancy. So what are some of the things that cause colon cancer, especially among men? Again, from latest medical journals that actually show, again, red and processed meat, having a diet that is low in fiber, not being active, so having a sedentary lifestyle, smoking, excessive alcohol consumption, again, obesity. You can see same factors, just as prostate cancer can also lead to cancer of the colon, cancer of the large intestine. So we need to really watch our lifestyles, because really cancer is not pretty. By the time it looks like this, it's too late to do anything. It's too late to do chemo. It's too late to treat. It's too late to cure. By the time that cancer has really, really, really spread, as you can see here, you can see this all black part here, that is cancer that has been removed after surgery in one of our patients, and it gets really eaten up. It looks not very, very pleasant, and the cancer spreads, and can spread to different parts. As you can see here, spreads to different part of the body. There's a picture of stomach cancer, this picture of intestine cancer, and this is a picture of the brain. And you can see I mentioned to you that cancer can actually spread to the brain, as you can see here. So it starts off in the prostate, can start off anywhere, really, liver, even go and end up going to the brain. This is a picture of liver cancer, and you can see the normal liver is this darkish brownish part here. This is normal liver. But all these whitish blobs that are huge, this is a picture of the cancerous cells. So you can see in this man's liver, he had more cancer than liver. And really, at the end of the day, the risk factors are the same: alcohol, obesity, lifestyle factors like smoking, diet. So really, at the end of the day, we need to watch our lifestyles, because that is the number one way to make sure we do not get cancer and cancer blobs. So for men, we need to think about how we live our lives. And I'll give you a few tips today. Now, I know the economy is really tough, and I love this. Lock up anything that consumes your money unnecessarily. So as you can see for this gentleman here, he's already locked in. All right. Very good, important financial advice for for us as men. But shifting gears, really, we need to talk about one of the biggest things that I see when men come to see me is they'll usually come, say, hey, doc, I have some back pain, I have some stomach pain. And usually they come with their wives or their girlfriends or, a colleague. And then I give them medicine for, the back pain, or medicine for, for the tummy. And then as they're starting to go, they tell their wife, okay, ningoje huko nje, just wait for me kidogo, kidogo. I'm coming. So then he closes the door and comes back to me, and now alone, and says, so doc, actually the main reason why I was coming to see you is unajua siku hizi my batteries are a bit low, huh? Daktari, what can you give me something? Because najua Abdallah hasimami. And that's the real reality. A lot of men are quiet, but they're actually suffering from erectile dysfunction. I love this. Between 20 to 40 years, you can try weekly. But at the age of 40 to 60 years, you try weekly. And then 60 years above, you can try. But when you're trying weekly. For those of you who may get that, I thought that was fantastic. But at the end of the day, we know that testosterone levels, which is the male hormone responsible for you being a man, starts to reduce, not in your later years, but actually by the age of 30, it starts to reduce. Now, are there things that I can do to make sure my testosterone stays up? Because all men, we love testosterone. That's what makes us masculine, what makes us strong in many ways. And yes, the answer is actually exercise, being able to cut alcohol, and changing of diet. These three are the only things that have been scientifically proven to reduce the rate of testosterone reduction in us and promote a healthy male sexual drive. So look at yourself really at the end of the day. And this is another questionnaire we can go through some other time. But over the last 4 weeks, have you had any issues in terms of sexual function, being able to initiate or even sustain? If the answer is yes to any of these, then you need to see a doctor, because we need to be able to assist and also do some hormonal checkups for you. And remember, at the end of the day, your lifestyle is the biggest risk factor when it comes to erectile dysfunction, or it comes to sexual dissatisfaction. Alcohol, diet, exercise, stress, and obesity are some of the biggest risk factors. However, other things, there are other medications, some medication for high blood pressure, some medication for diabetes, some medication for cholesterol. Some of them can also cause decline in erectile function. So we need to really think through our sexual function. Many of us go for drugs such as Cialis or Viagra to improve sexual function, but that is not sustainable. As I've mentioned to you, the only things at the what we call the trio that actually help in terms of erectile dysfunction is exercise, diet, and alcohol reduction, the magic trio. So we've talked about breakdown moments, so different diseases that can hinder our journey towards good health. How do we maintain our cars? How do we maintain our bodies? How do we put fuel? How do we tune up on a year-on-year basis? We need to think prevention. And at the end of the day, this is lifestyle. We know that cancer itself can be prevented by the same things I've mentioned: exercise, alcohol, diet. These are studies that have been done. We know weight on itself causes more than 13 different types of cancer. Even for females, breast cancer is a good example. Even ovarian or cancer of the womb can be caused just by being overweight. So please look at yourself, look at your scale today. How much do I weigh? Am I making myself more prone towards getting cancer? Just like my dear friend here who is on his border on the way to work because he's late. You know, we need to think really about obesity, about our public opinions, what these guys call the strategic reserves. Why? Because we know that the tumbo fat or the belly fat can actually cause diabetes, can cause kidney disease, can cause high blood pressure, can cause heart failure, can cause cancer on the other hand. Just like my friends here, let's look at this challenge. You think you'll make it?
You are muted, Dr.
Pressure, diabetes, obesity, all these are linked towards our diet. And interestingly enough, a lot of my patients whom I've been able to reverse diabetes, I've been able to reverse high blood pressure, we remove insulin, remove people's pressure meds. The key has actually been diet. So we know that diet, even with cancer, has a big role to play. And I'll talk a little bit about that. Have you ever heard of the blue zones? These are areas in the world where people actually stay above or live to be more than 100 years. There are 5 blue zones in the world: California, Italy, Costa Rica, Ikaria in Greece, and Okinawa in Japan. And what they actually found is that in order to live more than 100 years, they had a common kind of a diet, a common diet. And you can Google bluezones.com, blue zones, and they will actually show you what is this diet that can actually make you live longer and healthier. And we can see 95 to 100% is actually plant-based. We can talk about diet on another session, but really this just shows that being able to watch what is on your plate has a direct correlation towards your mood, energy, sleep, even your sex life, and protection from diabetes, hypertension, cancer, and many of the other chronic diseases. We know that diet is key. We also know that exercise is important. And for those of us who want to know, and I'd like us to write this down, FIT, FIT, because not all exercise is important or beneficial for your bodies. It's only an exercise regime that conforms to these standards of FIT. So F stands for frequency, I stands for intensity, T stands for time, the other T is type, FIT. So we need to exercise 5 times per week. The exercise we do needs to make us pant and sweat. We need to exercise at least 30 minutes per session. And the main types of exercise that can actually make sense for your diabetes, high blood pressure, or your heart Reducing cancer is jogging, walking, swimming, cycling, skipping a rope, aerobics, or doing gym cardio. So the next time you really think about your fitness, please, we need to walk the talk. This is a South African minister for fitness. He looks quite fit. This is the minister for sports, Uganda. So we need to lead from the front. We need to lead from the front, even in church and in the pulpit. We need to make sure that we move. We know that taking steps, just a little bit of fewer steps, can actually reduce your risk of heart disease, of stroke, of heart failure. Another study that showed that the minimum required per day is actually 7,000, which is very interesting because many of us think 10,000 steps is what we must achieve, but they show that 7,000 steps a day is actually has the same effect as 10,000 steps. And this reduces cancer, dementia, heart disease, and many other diseases, cancer, depression, even risk of death in general is reduced by just 7,000 steps per day. Many of us are unfit, and then whenever we try taking steps, we have our hearts that you say, hey, utasimama ama nisimame. I know most of us, we need to get fit. We need to get back to action. Why should men exercise? Exercise also reduces prostate symptoms. It reduces erectile dysfunction. It reduces anxiety, depression, improves quality of life. Another study that shows actually exercise has a direct correlation to your mental health. Really, really important. Even when you're pregnant, for those of us ladies who, know someone who may be pregnant, exercise is really, really important. And it is as effective as therapy for depression. Another study on 14,000 people. Improving fitness reduces the chances of developing prostate cancer. That's another study that was done. So we need to get to getting fit. Our gym instructors can be very, very inspiring, and sometimes, they challenge us a lot. And we may not be able to be exactly like our gym instructor, but just look at this guy here. He's doing his best. Every little bit helps. Every little bit helps. We need to move. We need to move. Not like this child here who is saying list 3 animals that like moving at night. Number 1 is bats. Number 2 is rats. Number 3 is daddy. No, not that kind of
Giraffe.
thing for us who are parents.
What is it?
That's not me.
Our children are watching and they see how we look. Again, really, we need to think about our weight, obesity, fruits and vegetables, animal fat, lack of exercise, tobacco, alcohol. These are the main factors that are responsible for cancer. So, what should your optimum diet look like if you want to think about preventing cancer? What should your diet look like? We actually seen all the studies that have been done have shown that plant and plant-based products, tomatoes, berries, broccoli, nuts, fruits, actually have chemicals that prevent prostate cancer. So we need to go green. We need to go for bright colors. There's a certain chemical called lycopene that is found in vegetables that have bright color. And this chemical called lycopene has been shown to actually reduce your cancer risk. So let us put more color on our plates. And number 2, we need to avoid meat because meat can give us lots of headache sometimes. Take more nuts. Nuts are really important for heart protection and for being able to prevent cancers as well. We need to go heavy on our fruits, our vegetables, our grains, our legumes, and our nuts. And we avoid KFC at all costs. I hope there's no one here who has shares in KFC. But on a lighter note, really, we need to think like this gentleman here is having his ugali and KFC. At the end of the day, we know that our types of diet is really, really, really important. We know that low fiber, or what we call Western kind of diets, have a direct correlation. Another study that was done to cancer, to obesity, to diabetes, to heart disease, and we need to have enough fiber in our diet. How do I know that I have enough fiber in my diet? The best answer is you need to look in the toilet, look at your stools. If your stools are small and hard, then you don't have enough fiber in your diet. There's little water in it. On the other hand, if your stool is large and it's, this is like a gold winner specimen, this is fantastic, this is a winner, then you know you have enough fiber in your diet. If you have large stool, then you'll need a small hospital. But if you have tiny hard stools, then you'll actually need a larger hospital. So we need to take care of what we eat. How do we do our diagnostics for our cars? How do we do our diagnostics for our bodies? Are you checked up? We need to really know at the end of the day that doing your checkup, doing a good wellness program is the key, because you're able to catch things early. You need to catch things early. Now, Mercedes-Benz on the other day were promoting and trying to market one of their first bulletproof, models. And the salesman, came and even said, "You know what? I have such confidence in my Mercedes Benz that I am selling. Huh? I will even sit inside it, and you can shoot at the car, and I have full confidence that nothing will happen to me." You can see that's a salesman. It looks, it's like, yeah, nothing happened to me. I'm good. I'm very, very, very confident. But you can see what happened to him. He was actually scared. But the good thing with having a good wellness program is that it gives you confidence. Why? Because you catch things early and you're able to protect yourself from disease bullets. And those are some of the things that we talk about in our wellness center. In terms of wellness, why is wellness important? There's a financial benefit from doing a wellness program. You know that every $1 you spend on a good wellness program, you actually get a return of investment of 3 times. Then you prevent 75% of all healthcare costs for your company and also for you as an individual. So please go for your wellness checkup. Really, really important. Many places you can get a good wellness checkup with a full body screening, from your blood, liver, kidney. It is good and important for you to go for one that is designed specifically for you, not just one blanket, just the same way you will not take, a Toyota car and use the same service parts for a Mercedes. You need to tailor make for the car. The same way you need to do that for your body. Get a wellness checkup that is well designed for you. This is just an example of some of the wellness products that that we're curating together with Yvonne in Liaison. Just tailor made for men in all stages of your life. And you need to have something good for mental health, something good for your back, something good for your hormonal profile, your prostate, your kidneys, a full body physical. Some of the products that wellness packages that we did in 2025, quite comprehensive, and you can see at different cadres. So someone who wants something very comprehensive would go for platinum. Someone who wants a quick check would go for the bronze, but it still has something for every one of us. 2026, we actually have some wellness packages that we are designing, really, really new, called His Care Wellness Packages. Really, really good for each of the different years. So you between 18 to 29, there's something for you. If you're all the way to 50, there's something for you as well. And we're able to do a full head to toe so that we catch things and we catch things early. You can see this is just an example of the His Care signature package, and you can see kidney, liver, blood count, hypertension, cholesterol, obesity, body fat, body minerals, body muscle. We check your testicular function, fertility screening, kidney, bladder, prostate, able to look at your testosterone, your hormone levels, able to look at your bones and your joints, your calcium, different minerals. So having a good diagnostic, a good routine checkup is really, really, really important so that you can have the winning formula for your race. You can have a high performance strategy. And what does that really look like? Most of us come to hospital when we have disease, when we are sick, when we can't take it anymore. And that's when you have many medications, you have symptoms. You're on this end of the illness spectrum. Many doctors will try and reduce your symptoms so that you can be at a neutral point. But this is what we call false wellness because the disease is still there. It's just you're not feeling the effects of it. Someone has put a bandage. Can I challenge us as men to take the full illness to wellness journey where you may have diabetes, you may have high blood pressure? We not only get you to a place where you don't have symptoms, but we get you to a place of high level wellness where your body can actually repair itself fully and you can actually survive on minimal medications or no medications. How do you do that? That is really, really possible. And we do it for diabetes, we do it for hypertension, many of the chronic diseases, really. The trick is being able to detect your risk factors. What are the things in your life that are promoting disease? I'll give you an example as we close of what illness to wellness really looks like. This guy I saw August, he had high blood pressure, he was 105. We didn't give him any medication, we just put him on a illness to wellness journey. And about a week later, his blood pressure was normal and he had lost 3 kilos. Another one had high sugars when I first saw him, 21st of August, high blood pressure, weight of 88. Again, 2 weeks later, he's dropped 6 kilos, his normal blood pressure, his hemorrhoids had disappeared, and I didn't give him medication. This is another one, 61 years old. I saw him in the beginning of the year, February. He had diabetes, he had high sugars, high blood pressure, high cholesterol. But by the end of the year, he was off his medication for diabetes, he was off his medication for cholesterol, he was on half a tablet for high blood pressure, and he had normal figures. It is possible to actually, this is what illness to wellness actually looks like. And we do this by having a good program, what we call a CDM, chronic disease management program, that enables you to move from illness to wellness. And we do a number of things that really, really help diabetics, help hypertensives, people with arthritis, people with cancer, people who want to really manage their weight. For on average, people in our program lose about 2 to 4 kilos per month. And this is something that we really need to think about, taking wellness practically, taking it individually, making it make sense, not only for our health, but also for our pockets. Another example, this gentleman is a banker, 43 years old, came to see me. He was spending about 6,500 shillings on medications alone. But by the end of our journey with him, a couple of months, he was actually only spending 1,900 on his medications. That's a 70% decrease. Again, why? Because he took time to sort out his risk factors on an illness to wellness journey. And that is really your strategy for high performance. So, the road ahead, what next for you? What do I need to do in my life? I hope we are all reflecting, what changes should I need to make? Do I need to go for a checkup? Do I need to go for a wellness package? Do I need to change my alcohol consumption? Do I need to talk to someone about my struggles, my mental health? Do I need to sleep better? We know that men who sleep 7 to 8 hours a night have 60% less risk of a heart attack. Do I need to climb more stairs instead of using the lift elevator at work? Let me just climb up to 5th floor because that will give me my energy and my exercise for the day. Do I need to eat better? Because at the end of the day, heart disease, diabetes, cancer, I've talked a lot about. I've talked a lot about that. Some of the changes that we really, really need to make to move from illness to wellness. Make your small baby steps. Baby steps are important. Never give up. Your journey is yours. Your journey is personal. It is individualized. But as long as you're moving from point A to B, then we can make a lot of changes. I know I've given us a lot of information. I've packed a lot into 1 hour and talking about men's health awareness. I hope we've made a little bit of sense. I know we are almost graduating with a PhD in men's health.
When I finally graduate with my PhD, not even my wife will be allowed to call me baby. It will be Dr. Baby.
What changes would you want to do today in November 2025 as a result of our men's health awareness? Remember, so many people spend their health gaining wealth, and then they have to spend their wealth to regain their health. Let this not be your story. Thank you very much. I hand over back to you, Yvonne.
Awesome, Dr. Thank you so, so much. You can see the claps already coming in. But we still have a few minutes to go through the Q&A. I have seen some questions in the chat box, and I think we can just head there. I think I'm also graduating with a PhD there, Dr. I'm not sure what I'll be called. Yeah, so back to
you won't be called Dr. Baby?
That sounds like a good one. I think I can adopt that one.
Yes, yes.
For sure. All right. So a lot of commendations saying thank you very much and requests to share the presentation. We will definitely share the presentation and the recording for those who are not able to catch up with the presentation and for those who have also missed. And yeah, so going back, there's a question here asking, alcohol reduces the rate of decline of testosterone. Maybe you could clarify on that. That's from Joseph.
All right. So I talked about diet, exercise, and alcohol. So alcohol is actually alcohol cessation. So stopping alcohol will reduce the rate of testosterone decline. But the more alcohol you take, the faster and the more your testosterone will wear out and go down in your body.
Thank you. All right. Yeah, so there's a question here from George. Is it advisable to rely on sauna as part of relaxation, and does the sweating have any health benefits?
Now that's a good thing. So saunas give you a feeling of being relaxed, but at the end of the day, in terms of your mental health, the only way to make sustainable, real gains in your mental health is to address issues head on. And mental health support, being able to have a counselor or a psychologist to help you work through, we call it cognitive behavior therapy, meaning I train myself to take charge of my mind, to take charge of my thoughts so that I can control how I'm feeling and my reactions to situations. That is the only thing that can help mental health. I have my own therapist that I go to, and who has helped me along my own personal journey. And it's something I encourage all men to do. It improves performance at the workplace, it improves performance at home, it improves performance in all areas of our life. Mental health is a killer. It's a big thing, and we need to take it seriously.
Okay. All right, Dr. Okay, so I guess that answers the part. So there's a comment here from Steven says, you guys, this presentation is both informative and entertaining. Yeah. All right.
Thank you.
So the questions about the packages, I think we will share the packages. And yeah, so for anyone interested, also feel free to log on. I mean, reach out to us, and then we can be able to share much more about that.
Yeah, I can
of
comment on that. Yeah. I see that someone asking what the packages are. So we tailor make how much they cost. So we tailor make our packages based on an initial assessment of you, so that we give you something that is relevant. But we have packages all the way from 7,000 to 20, even 30,000. So it depends on how intensive and how comprehensive people are. We also do on-site wellness checks for companies as a whole. So we set up the whole hospital in your office and make it convenient for you to be able to do that. And Yvonne will be able to advise anyone who is interested in such an arrangement. Yeah, thank you.
Awesome, great. There's a question here about meat. It's asking, is meat or eggs bad? I'm told protein intake is very important for our health.
That's a fantastic question. Maybe one day we can do a nutritional webinar. But yes, there is a difference between plant protein and animal protein. So we know that plant protein are more efficient, and it's like burning a dirty fuel vis-a-vis a clean fuel. So the dirty fuel, yes, will give you the energy to move, but it will produce a lot of smoke vis-a-vis a clean fuel like gas, which does not produce smoke. So I'm sorry, there's someone who needs to mute. So animal proteins are less efficient, or they're more, the body metabolizes them and gives side products that are actually harmful. And so we know that animal proteins have been associated with different cancers, have been associated with different chronic diseases, but plant proteins, on the other hand, are more efficient and they're cleaner to use. Yeah.
Okay. I think there are no more questions, Daktari, but I would request if anyone has any question and is that free to unmute and ask the question just before we wrap up. I know we have learned a lot today, quite a lot to digest. I can see there's a question here from Blaze. What about sugar for men between 40 to 45 years old? What is the correct way to use or to remove it?
That's a good one. So yeah, we actually have a full presentation on sugar, but sorry, there's someone who needs to mute. Yeah, so to answer really about sugar, yes, we know that sugar, yes, gives you energy, but too much sugar now causes obesity, it causes diabetes, it causes a lot of metabolic issues and diseases. So what we say about sugar, not just for above 30, but for anyone, is that you need to have just the recommended allowance of sugar per day, and we call that 100 grams. So basically, any carbohydrate has sugar. So be it ugali has sugar, rice has sugar, potatoes have sugar, spaghetti has sugar, ndoma, ngwashe, chapati, bread, all those have carbs which are converted by sugar into the body. So it is a matter of being able to tailor make and know what is your recommended daily allowance, and don't go beyond that, because if you go beyond the daily allowance of sugar per day, then that's how we now begin to get our kitambis. That's how we now get a lot of these diseases that are associated with obesity. So sugar needs to be taken not just as teaspoons, but you need to take into consideration carbohydrates and starches as a whole, because the body breaks that down and processes it into sugar.
Thanks, Daktari. There's another question here. Someone's asking, what causes prostate cancer?
So yes, that's a good question. I think I've talked a bit about it earlier, but above the age of 50, all men get prostate enlargement. So your prostate starts becoming bigger because of your hormones. Your hormones go down, your prostate becomes bigger. Now, what the issue with that is that because it's becoming bigger, some of the prostate cells now start dividing and multiplying more than it's required, and hence they transform into cancerous cells. Now we know that genetics plays a role in this. So if you have someone in your family or relatives who have prostate cancer, that can make you get prostate cancer. But we also know that there are other lifestyle and environmental risk factors, which I've mentioned already, such as diet, such as alcohol, such as lack of exercise, that also promote or lead to prostate cancer. So prostate cancer has a combination of both genetics and also your lifestyle and environment.
Okay. All right. Another question here is, Doc, do you imply that we stop taking animal proteins completely?
So that's a good question. If you're able to avoid animal proteins, it's actually the way to go. We know a lot of, we have a lot of American data, we have a lot of European data that actually show that plant-based diets are actually what is recommended for healthy living and for disease prevention. If you're unable to fully be vegetarian, then it is important to know how to limit your animal protein intake. And usually I try to advise people avoid red meat at all costs. It is more harmful than white meat. So have small portions of white meat, but have maximum portions of plant and plant-based products.
Awesome. Thank you. Dr. There has been questions about PSA, the test itself. Maybe you could just explain what it entails, because we're in the process of encouraging men to go for checkups, and there has been a lot of questions around that. So maybe you could just debunk on how nowadays we check for prostate cancer.
So that's a good thing. Remember, I mentioned the PSA is a blood test that we do. The PSA is actually a chemical. It's a chemical that is produced by the prostate when the prostate is injured, when the prostate is sick, when the prostate is complaining. It produces this chemical and releases it into the bloodstream. So we do a PSA test by taking your blood and look for this chemical. And so there are certain levels that are acceptable for a normal prostate, but there are others when it gets high, we know that, hey, your prostate has an issue. It either has an infection or it has cancer. So we know that your PSA, your prostate levels need to be checked at least once a year. We recommend once a year. It's a very nice small test that can be done. Most facilities. I know I saw.
Can someone reduce kitambi?
Sorry, Victoria. Yes, we all need to reduce kitambis. But yes, the prostate check can be done in many facilities, from as low as like in our facility, we do it for 2,000 shillings. I know Aga Khan does it for 5,000. So there are different places where you can get your prostate checked.
Great. Thank you, Dr. for answering that. And I know we're in the process of doing and running wellness camps at various organizations. And so this is a call out to all of you. Please show up, men. No more digital examinations for this particular test. It's just a blood sample. So please show up for the tests. One last question, Dr. here. Henry is asking, how can we get rid of the kitambis?
Fantastic question. It's actually my favorite question. So in September, we actually launched a new product for kitambis and associated deposits of fat on a lighter note. So we know that, and in this program, on average, we able to attain about 2 to 4 kilos reduction in weight per month for all our clients. There's no client who has joined us who has not been able to reduce by 2 kilos per month. And really, how the secret towards it is actually diet. So many people spend so much time in the gym and so much effort and money in the gym, but we know that exercise and gymming will only reduce your weight, by about 20%. 80% of weight reduction is actually attributed to diet. So knowing the right amount of carbohydrates is the key. That's the secret. So that you're not starving. So like all the patients who are on our weight management program, they don't starve. We don't put anyone on any fasting, intermittent fasting or whatever type of fasting. We don't. We just teach you and train you to know just the right amount of carbohydrates to eat in a day so that you don't overdo it and get the extra weight, because we know that all the weight around your tummy is related to your carbohydrate intake. So diet is actually the secret towards weight loss.
Very well said. Very well said. I think it's a very informative session, Dr. And I think as at today, I want to adapt that name only for today as Dr. Baby, because I feel I have learned so much. I could probably now teach more people about the same. Yeah. However, I'd like to take this opportunity to find out, is there anyone with a burning question before we wrap up? Feel free to raise up your hands. I'd want to hear even at least a voice. Anyone? Yes, Beatrice, go ahead. Unmute.
You skipped my question. I had written it on the chat. I think about if one has been tested and the PSA is down, it was up and they were on treatment and it's now coming down. What is the way forward? Maybe you can give suggestions. You can hear me?
Yes, we can. Yes, Beatrice.
Okay, just check. Yeah, just wanted to know what you can do. Thank you.
Okay, it will be difficult to comment on that because I don't have the benefit of the full medical history. But really, PSA also if I can answer or attempt to answer, PSA levels, tracking them and trending them so that you can see whether they're going up or down actually helps us know how stressed the prostate is. So if you find that the prostate levels once were high, but now are going down, then that's a good sign. It means that whatever treatment that you're doing is actually helping and working on the prostate. So there's a PSA, and another way you can also be able to know if your prostate is getting better is also you can also scan. So there are ultrasound scans, which we also do sometimes in our wellness packages for corporates. So doing an ultrasound can help you see how big the prostate is, if there are any cancer cells. MRI is also another way of looking or tracking the prostate disease. But the easiest and quick method is actually the PSA.
Okay. Thanks, Daktari.
Thank you. Thank you. Yeah.
Okay. One last question because I asked for one. What's the best way to consume plant protein? 100% raw or little simmered or cooked?
That's a good question. I'd say a combination of all the above. So there are certain advantages to cooking. There are certain advantages to raw. So I'd say mix. I'll give you an example. If you take let's say a raw tomato, and so it's not cooked, you get a lot of vitamin C. But if you cook the tomato, you destroy your vitamin C, but you increase your lycopene. Remember, the lycopene is that chemical that helps to prevent cancer. So I need vitamins and I need lycopene. So I will make sure that some days I have a fresh vegetable salad with raw tomatoes, and other days I can have a tomato soup. So there's no form that is better than the other. We need to be able to have a good blend of cooked vegetables and also raw vegetables.
Okay. Thanks, Daktari. And I have a question for all of us who are here today. Have you gone for your annual wellness checkup this year? Personally, I've gone for mine twice now. And so mine is to encourage you that before the end of the year, please make use of that benefit. It is part of your medical cover. So please do make sure to utilize it. If there is no further,
my hand is up. Sorry, my hand is up because some of the tests like mastectomy, you go and the machines are not working in most of the hospitals. Where can we get one working for over 50?
What test? Come again?
Are you speaking about mammogram? So yeah, mammograms are
Mammogram,
they're big machines. First of all, they are not very portable, and they're only housed in big hospitals. So I know Kenyatta Hospital has a mammogram machine, Nairobi Hospital has one, MP Shah, and also Aga Khan Hospital. I don't know of any other main facilities that have mammogram machines that are reliable. But any of those four will be able to help. For ladies, which maybe we can talk about ladies another day on breast cancer, but ladies, we say that mammograms need to be done at least once a year is important to be able to screen and check for breast cancer. For those under the age of 45, we actually say you can be able to use an ultrasound, which again is portable and can be done in any wellness checkup. Ultrasound is sufficient.
Thank you, Daktari. I hope there's no other hand that I have left out. All right. I hope your question has been answered and you're good.
Yes, I'm good. Though I've been to Nairobi and I went to Mpisha and it was down. Nairobi, I think, I don't know if they have a special category of people they use the machine on, but anyway, I'll try again. Thank you.
Awesome. And I'll drop my number there so you can reach out to me and we can continue this conversation and try and figure out where we can get one that will work for you.
Thank you. Thank you.
Okay. All right. Thank you very much, everyone, for making time to attend. Thank you for all our first-time visitors from National Bank and many others that we cannot stop mentioning, but you're almost welcome. And see you again next month for our last webinar of the year. And thank you for all of you who've been with us from January all through till now. It's always been amazing hosting you for this webinar. So have a great day. You're free to leave the session.
Thank you.
Thank you very much, Yvonne, and to the rest of the audience. Thank you so much. Have a beautiful, amazing November. Bye.
Bye. Thank you. Bye.
Thank you, Daktari.